Hey guys, Dr. N here. Today I want to show you, in the last couple weeks we kind of discussed what happens when we have low back pain with symptoms down the leg, right? So I want to show you a little bit about what we would do if we were going to use something like Shockwave therapy for a disc problem. Now, Shockwave, what it does is it breaks up damaged tissue, breaks it down into tiny little pieces. Your lymphatic system will kind of clear that damage out, and then stem cells will flood the area and start to help the healing process and the regenerative process, okay? Now, Shockwave itself is not going to fix a disc, right? If you have a disc herniation, it's not going to just start to kind of like blast an actual disc bulge or disc herniation into oblivion, right? But what we're trying to do is we're trying to lay the foundations and reduce as much inflammation as we possibly can so that the body can start to really like maximize its own healing process through this area, right? So your body, and it'll certainly help with rehab and all the other things that we're going to do here in the office. So it helps what you do at home, it helps your body, and it helps what we do here in the office in terms of the rehab parts to maximize healing and maximize pain relief so you're not dying all the time, okay? Now, with the disc, kind of depending on the size of the person, we need to get really down deep. So Shockwave can actually go 5 inches deep if we were to take all the head pieces off and just kind of go right on the bare part. No, for Miss Regina, that would be too much. So maybe we would use standoff 1, so it'll kind of bring it a couple inches narrower, right? Someone who's really bigger, we might kind of go even less, or with nothing. But we do need to get a couple of inches down deep so that we can kind of hit the disc area itself. And again, what it's aiming for is it's going to aim at reducing the inflammation, reduce some of that swelling, and really kind of prime the area, hopefully, so that there's the least amount of swelling and inflammation going on, so that our rehab and all of our other treatments are going to be working as best as possible, right? So I'm not going to show you what it looks like right now, but really it's as simple as we would probably use the focus Shockwave instead of our radial unit. Our radial unit is fantastic for like big muscle spasms, so we would still use it for some of the lumbar paraspinals, but really we want to hit right on top of the disc. I'm going to show you what it looks like. So we probably wouldn't use this standoff, but we would put it hang out right on top of that disc, and we would just find the sore spots, and we would just stay there for a good like 500,000 pulses, all right? And then maybe find another spot. But really, we're just trying to find that one disc and just hang out there as much as we possibly can to the patient tolerance, just to kind of help with some of the healing in that area, right? So as I was saying, Shockwave itself is not going to fix your disc, but it's certainly really good for pain control and help with the long-term healing of that problem, okay? So if you have any questions, send them my way, and always remember to live with passion.